Hello, everybody. Good morning. Good morning. Good morning. Good morning. Good morning. Happy Good Friday to everybody. Gonna get our guests in here.
Hi there.
Good morning. Hey, how are
I,
you? Good morning. Good morning.
good morning.
Thanks for joining, Roxie. We are live, giving
Absolutely amazing.
everybody. Yep, we're giving everybody a minute to join us here, and then we'll get started in a second. But thank you for joining us. Good afternoon to everybody. Happy Good Friday. Happy Passover to everyone. We're giving everyone a second. We're going live a little earlier than normal today, so we're just giving everybody a second to join us. Thank you all for joining us for the Friday, April 10th. Brandon's briefing, COVID-19 briefing. We have another very special guest today. So we'll just give people another minute, minute and a half to join us, Roxy, and then we will get started.
All righty. I'm going to get myself set up here.
All right. To get set up. I hope everybody's having a good, great day. Everyone's staying safe and staying inside.
There we go.
60. And we'll get started. All right, all right. No, you're welcome. Thank you, thank you, thank you. Thank you for allowing us to be here. Thank you for allowing me to serve you. All right, 30 seconds and we'll get started. 30 seconds. 30 seconds. Hello, hello, hello. Hello, hello, hello. Hello, hello, hello. All right, everyone, we are going to get started. Welcome to the Friday, April 10th, Brandon's COVID-19 briefing. Today we have a very special guest, Roxie Herbekian, president of the Unite Here Local 7 Union. We're going to talk directly with Roxie in a few moments about COVID-19 and how this pandemic is affecting our service workers. And we're going to give Roxie a good bit of time to talk about that. But I want to give you guys the latest update. We are now up to 6,968 cases of COVID-19 in the state of Maryland, with 689 of them being from the city of Baltimore. As we talked about last night, the governor finally released racial data around COVID-19 in Maryland. We know that last Monday I put in legislation that would force our health department to share that information by race and by zip code. And what we know is that this virus is affecting African Americans at alarming rates more than anyone else. So listen, I said this last night when we had Senator Hayes. I'm going to say it each and every day. Everyone needs to take COVID-19 seriously, but African Americans, Black people, we have to take it more seriously than anyone else, because we are the ones dying from it at enormous rates and enormous clips. The myths are not true. Black people can contract COVID-19. We don't want anyone passing away. We have to be leaders in our own community and let everyone know that, yes, just because you're Black, African American, you're still very much so at risk. And even the data is showing us more at risk to contract COVID-19. So practice social distancing. Follow all the rules and guidelines, and don't take this as a joke, because it will take you away from here. It will take you away from your family. It will take your family members away from you. So we are now still pushing. We asked the mayor's office to share this information by zip code, which they did. But we're going to continue to push to have the local data shared by race as well, so that we know exactly where to go and who we need to talk to when we're talking about trying to stop COVID-19, treating people, services, all the things that need to happen for making sure that we're getting out of this crisis and working through this crisis as well. But now I want to turn to our very, very special guest. Roxie, just wanted to first allow you to give you an introduction to the folks out in the social media land, talk about you, the union, what you guys do.
Great. Thank you very much. Thanks for inviting me on the program, President Scott. My name is Roxie Herbekian, and I'm the president of Unite Here Local 7. Unite Here is the union in the United States and Canada that represents hospitality workers. Our members work in casinos, hotels, restaurants, and we fight hard to improve the conditions for all hospitality workers. Local 7 is primarily in Baltimore and also in Ocean City.
All right, Roxie, let's get into some questions for you. How have your service employees, your members, been affected by COVID-19?
So this has had a huge impact on all the workers in the hospitality industry. In early May, folks were getting ready for busy season, baseball, conventions, meetings, expecting to have a lot of work. And then, places started closing. And for good reason, for the safety of all of us. And I really appreciate your comments about that. We have to take this very seriously. And what happened is events started getting canceled, places started closing up. A couple of the hotels in town are completely closed. The others have hardly any business. The casinos closed. I know all the restaurants are closed. Some of the university cafeterias have a handful of employees. So I would say that probably 95% of all the hospitality workers in the area are on layoff. So this has been huge, and it's hit just at that season when people expect to be working a lot.
Yeah, and this is why you consistently, we're talking about uplifting and making sure that we are supporting these individuals through this time, making sure that we can bring any resources to them, making sure they know about the resources that are available. What are some suggestions that you have for service workers who may have been laid off? How are you working with the members to try to help them through this crisis?
Thank you. We in touch. So all the organizers we're all working from home. The office is closed, but we get the calls, and we have been calling all of our members to do two things. One, make sure everyone's okay and safe and practicing safe practices so that they get through this pandemic. Two, get people enrolled in unemployment insurance. All the federal programs, everything, it runs through being in the unemployment system. I know it's been really tough for folks. The system is overrun. We very much appreciate the public state workers who are working long hours. It's been frustrating, but we've been working with people to get enrolled, to get into the system so that they can access their benefits, and also been working with some employers to get additional finances and benefits. Some employers like Hopkins and the casino and the Marriott have been willing to give additional financial aid to some of the workers. We're trying to have that discussion with the Orioles. So we've been doing that, as well as helping people get set in their unemployment and understand how all these federal programs work, like the tax advance and so forth. So people will have that. And we're also starting to raise funds to have, so that as this goes on, if people have problems, we're going to be able to give them some help. And I just want to say that the resources we've put together in terms of where to get help, where to get food, those are available to all hospitality workers. If you go to our website, Unite Here Local 7, or our Facebook page, Unite Here Local 7, there's resources there, tips on how to do unemployment, what to do if you need food, how to deal with your landlords, sending letters, and how to deal with any loans you have. Those resources are available not just to our union members, but definitely to all hospitality workers, and honestly, any worker in the city. We have a whole booklet there of resources that people can draw on so that they can get through this really difficult time.
Thank you. Thank you. Thank you. Thank you for that, Roxie. We just wanted to make sure that everyone has that information. What are some of the concerns that your workers have expressed during this time? What are the things that you're consistently hearing from them?
Yeah. Well, people are anxious about this employment just because it's frustrating. We know that the system's going to eventually be able to work. That's one thing. Folks are worried about how long it's going to go on. Now in the unionized hotels and restaurants and casinos, people have guaranteed recall rights. Some non-union folks have expressed us concern about, will they be recalled? That might be something we want to look at as on a policy level to make sure that when these businesses do open up again, people will be recalled to their jobs. The other thing we're starting to hear is concerns about health insurance. You know, a lot of people have their health insurance through their job, and some employers have said, look, we're going to continue to pay for a certain period of time, but you know, it's understandable if it goes on for a very long time. People have got to be concerned about their health insurance, that and staying safe. But definitely, you know, particularly because, as you were pointing out, this is disproportionately affecting African Americans. People are scared and nervous, but we are concerned about what's going to happen when health insurance is cut off, and also the recall issue is a big issue for folks.
And Roxie, if folks wanted to try to support your members, is there like an official way that they can do that? How could folks support your hardworking members who work for and serving all of us typically? How can we now turn around and help them?
So I think, like I said, we want to have this emergency fund. We want people to be able to get through this, have enough food in the house, not have utilities turned off, any of that. If you go to our website, Unite Here Local 7, if you can make a contribution of any amount, or if you'd like to volunteer to help in some way, we've had some attorneys who've volunteered to give people some counseling on different issues they have, all appreciated. And you can always find us on our website, our Facebook page, Unite Here Local 7. And we appreciate, like I said, we want to be a resource for all the hospitality workers in town, not just our union brothers and sisters.
Yep, and the website for everyone is uniteherelocal7.org. There it is. Yep, uniteherelocal7.org is right in the chat for everyone to see. So questions, if you guys have questions, make sure as always that you get them in so that we can be sure to answer them as well. Roxie, I had one other question for you. When we're talking about, you may have seen some of the things that I have been talking about recently, like using the city's rainy day fund to help with workforce development programs for people that lose their jobs that may never come back, like some of your workers. How do you think, or what do you think, like the government's role is going to be or should be in trying to think outside of the box? Because this is a situation like we've never been able to be in, we've been in before. What kind of things do you think we have to be thinking about from my standpoint to support workers?
Thank you for that question. I just want to say we do really appreciate the leadership you've shown during this crisis, and you know, I know a lot of our members have seen you out there, everything, and we really appreciate that. I think that that from a policy perspective,
Oh, I think we lost Roxie. We lost you. So pause for 1 second. Your connection is bad, so your sound is bad. We can't hear you at all. So Roxie, I'm going to suggest that you go out of the live and then come back in. Yeah, yep. Go out and come back in. I'll re-invite you. All right, she's going to come right back, everyone. While we're waiting for her to rejoin us, looks like she had a bad connection there. We want to also remind you guys that you can find, we know that the some of the food sites are closed today for Good Friday and will be closed on Sunday for Easter as well, but you can always find the sites that are available at BeMoreChildren.gov, BeMoreChildren.com. We'll put the link for everyone to find it there. Oh, and there our guest is back. Give me 1 second. All right. Let's see. And you're back. Nope.
Hi there. Sorry,
We
I don't know what
still
happened.
can't hear you.
I don't know what happened. Sorry.
Yeah, we can hear you. Yep.
Okay. Can you hear me now? Can you? Okay. So I think from a policy, I think really keeping our finger on the pulse of what's going to happen with the industry. Like, what's going to come back? Is it not? And what that going to mean for work, right? What people are looking forward to, I hear from time to time, when are we going back to work? When is it going to reopen? And we don't know that it's going to come back in the same way. So I think really have your finger on the pulse in terms of what's going on in the industry and what kind of training or opportunities might we have to pivot to, so that when this pandemic is over, people are going to be gainful employment and back to as normal a life as possible. So I think education, job training, right now people are really focused on surviving, but I think that's going to be our next phase. Right now, stay safe, but next will be what's our gainful employment going to look like when this pandemic is over.
All right. Thank you. We'll see. We had some questions coming in. Someone asked, when will gig workers be able to apply for the unemployment insurance? We know there's a delay there. I'm going to continue to advocate with the federal government to try to make sure that these things happen quickly and happen as quickly as possible for everyone. So you should stay tuned on that. We know that everyone's hurting across the board, and we're going to make sure that we're fighting each and every day to help everybody that needs help here, because we know no one is being not impacted by COVID-19. So we need everyone to be mindful of that as well. I also wanted to remind people, while more questions come in, that the Pimlico testing site in Baltimore City in 21215, which is where most of our cases are in the city, open today. But again, do not rush up there to try to get a test. Testing is by appointment only, and you must have a doctor's note to even get testing. So people who are calling their doctor, who have a primary care physician, you should go that route. Those who don't have it, you again should always call 211, and they will refer you, and that's how you'll be screened over the phone. If you meet the eligibility requirements, then they will push you out to there for a specific time. You do not walk up, try to drive up there to just get tested because you think that you're feeling bad. You have to go there with a doctor's note, with the advice of public health professionals. This is how we are going to do that. I see someone said, give the people still working extra money and make sure they're protected. At the city, at the city level, we've done that by giving our people PPE, but also giving them a quote unquote stipend or bonus in addition to what they're doing and working. We've seen that happen in some supermarkets. For example, my mom works at Giant. They've gotten it. My brother works at Pepsi. He's gotten it. We've seen a lot of people doing that great work and trying to make sure that their workers are getting some sort of what people like to call, quote unquote, hazard pay throughout this. But we know that PPE is something that is still in high need for everyone, down to hand sanitizer. Yesterday, I did a visit. With another union, SEIU, over at the Future Care on Harford Road, where I was able to put them in partnership with someone who was able to give hand sanitizer to those frontline workers at that place where someone actually contracted COVID-19. So we wanted to make sure that everyone had that information, and it's also just reminding everyone how serious this is again. Roxie, is there anything else that you want to uplift from your workers' standpoint, or things that you think is important for everyone to know?
Just that, I think the number one thing is staying safe, staying together in terms of communication, support. It can be isolating being at home. Some people are bored. We are trying to keep with everyone. If you go to our Facebook page, go to our website, you'll find resources and a way to plug in and be connected with other people, even if it's just being able to talk to someone to see how you're doing. So, let's be a community. Let's be a strong community. We want to come out of this strong, together, and healthy. So thank you.
Thank you. And this, I would just like to say to everyone again, always thank you for tuning in. Reminder that you can find all of the resources about COVID-19 at BaltimoreCityCouncil.com and click COVID-19. Also, my COVID-19 asset map is at bit.ly/be more COVID map. That's when you can find all the grocery store hours for seniors, all the food sites for children at schools and rec centers, all the clinics that take people who don't have health insurance. All that information is there for you in that one centralized place to make it easy for you. We're going to continue to communicate with you each and every day. We have another digital council meeting coming up on Monday, so you can watch that live on Charm TV, Charm TV's website. We'll put the link in there. You can watch that live. You can call in. We'll be putting that out on Instagram over the weekend, or where you can call to listen into the council meeting. The draft agenda is available now at BaltimoreCityCouncil.com. We'll have some more COVID-related stuff coming out about through the council meeting, and things that we're going to be pressing for us to benefit the citizens of Baltimore City even more throughout this crisis. But the last thing I want to say is the first thing that I said, is that everybody has to take COVID-19 seriously. In particular, I want the African American community of Baltimore to take COVID-19 seriously, because we are seeing the numbers, and we know, looking at that zip code map, it's scary. And this is why we have to practice social distancing at every turn, making sure that if anyone calls you that you know that's talking one of these 5G rumors, or that black people are immune, you need to shut them up immediately and tell them to take this seriously. Don't be a fool. Don't put themselves at risk, their family members at risk, their friends at risk, their co-workers at risk. Be mindful, following the advice of public health officials, because this is a crisis. It's taking people away from here. If you look at the pictures, the startling images from New York, where they have like temporary grave sites for people. We have to take this very seriously. So thank you, as always, for joining us, everyone. Roxie, thank you for joining us. Please give your members our will. We're going to do everything that we can to support them. So thank you, everybody, and have a good evening, a good Friday, and a good Easter, a good Holy Weekend. Everyone enjoy and be so safe.